Assalamu alaikum wa rahmatullah. I am Dr. Ahmed D. Abdulwahab. I am a diagnostic and interventional radiologist working in Erbil, Iraq. Today we will discuss the findings of the yesterday published case about a 50-year-old male patient presented with some dysphagia, epigastric pain and generalized ill health. The CT scan of the abdomen and pelvis was done, and first we want to say that this dark thing here is a ring artifact due to a malfunctioning detector of the CT scanner. This is just a technical artifact. It has nothing to do with the patient presentation, and in this particular case it will not affect our findings. First of all, we need to say that there is this hyperdense something within the gallbladder, which is a gallbladder stone. It is not related to our diagnosis. And the other thing is that there is this lesion here, ill-defined lesion. I want to make a hard window a little bit. You can see there is an ill-defined, enhancing, necrotic, heterogeneous lesion in the liver, mainly in the right maybe in the right lobe, and it's necrotic, of course. When we see this kind of a lesion, the possibility of metastasis should be considered, and sometimes we can find the primary pathology, the primary tumor. Sometimes we can't. If we cannot find the primary tumor, this lesion should be biopsied, in which we put a needle just right here and take a little piece for histopathological diagnosis. The learning point from this case is the clinical history is of a very big importance. The history here is dysphagia, generalized ill health, and epigastric pain. So dysphagia indicates something with the esophagus, and we said yesterday there is a little bit of oral contrast seen trapped within the esophagus. So if we go down a little bit, and this is what the primary pathology, there is a soft tissue mass within the lower esophagus just above the gastroesophageal junction. This soft tissue mass is causing narrowing of the lumen of the esophagus, and if you go down you can see it bulging into the lumen of the stomach, like here. You can see how it's bulging, involving the gastroesophageal junction, and this is one of the things that I like about using oral contrast, positive oral contrast. So this will be an esophageal carcinoma with liver metastasis until proven otherwise. And if you go down, you can see the strengthening of the mesenteric fat planes, which could be due to metastatic involvement, could be due to mesenteric lymphadenitis, or could be due to paniculitis. All of them are possible differential diagnoses. So let's go to the coronal images and see what can we see here. You can appreciate the mass in the lower esophagus, and you can appreciate its extension into the stomach here. Just let me magnify this, maybe you will see it even better. You can see here it's extending into the gastric lumen, and you can see this is the mass, and you can appreciate the liver metastatic lesion here. It's a very big one. So this was a case of pancreatic carcinoma with liver metastasis. Don't forget to join our Telegram group. The invitation will be in the first comment. Thank you very much, and see you tomorrow.